Hi everyone. In today's clip, I will talk a little bit about ADHD. Just a reminder that anything I post here is not meant to diagnose or cure anything and is for informational use only. For any health-related matters, please consult your healthcare provider. So, attention deficit hyperactivity disorder, or ADHD, is one of the most common mental disorders affecting children as well as adults. Symptoms of ADHD include not being able to keep focus, excess movement that is not fitting to the setting, and impulsivity. Also hasty acts that happen in the moment without any thought. ADHD is known to impact the individual in many aspects of their lives, including academic, professional achievements, interpersonal relationships, and daily functioning. It also can lead to poor self-esteem and social function when not appropriately treated or addressed. So adults with ADHD can experience poor self-worth, sensitivity towards criticism, and increased self-criticism, possibly stemming from higher levels of criticism throughout their life. Now, surprisingly, this is more commonly diagnosed among boys than girls. However, this doesn't mean that boys are more likely to have ADHD. Boys tend to present this with hyperactivity and other externalizing symptoms, whereas girls tend to have inactivity. So many children may have difficulties sitting still, waiting their turn, paying attention, being fidgety and acting impulsively. However, children who meet diagnostic criteria for ADHD differ in that their symptoms of hyperactivity, impulsivity, organization, or inattention are noticeably greater than expected for their age or development level. Some symptoms lead to significant suffering and cause problems at home, school, at work, in relationships. The symptoms are not the result of an individual being defiant or not being able to understand tasks or instructions. So we have three main types of ADHD. We have predominantly inattentive, we have predominantly hyperactive impulsive, or we have combined. So a diagnosis is based on the presence or persistent symptoms that have happened over a period of time and are noticeable over the past, let's say, 6 months. While ADHD can be diagnosed at any age, it usually starts in childhood. When considering the diagnosis, the symptoms have to be present before the individual is 12 years old and must have caused difficulties in more than one setting. For instance, the symptoms can't only be happening at home, right? So taking a look at the three types that I mentioned, for the inattentive type, inattentive refers to challenges with staying on task, focusing, and organization. And for a diagnosis of this type of ADHD, 6 of the following symptoms that I'm going to talk about happen often, or 5 for individuals who are 17 years old and older. For example, they don't pay close attention to details or make careless mistakes at school or at their jobs and the tasks. They have problems staying focused on tasks or activities like during lectures, conversations, or long readings. They don't seem to listen when spoken to. They seem to be elsewhere. And so they don't follow through on instructions and don't complete school works, chores, or job duties. And many start tasks but quickly lose focus. They have problems organizing tasks and work. For instance, they don't manage time very well. They have messy, disorganized work, or they miss deadlines. They avoid or dislike tasks that require sustained mental effort, such as preparing reports or completing forms and things like that. They often lose things that needed for tasks or daily life, like school papers, books, keys, wallets, cell phones, and eyeglasses, and more. And they're easily distracted. And of course, they forget daily tasks like doing chores and running errands. Older teens and adults may, for example, forget to return phone calls or pay bills or keep appointments. Then we have the hyperactive impulsive type. Hyperactivity refers to excessive movement like fidgeting, excessive energy, not sitting still, and being talkative, impulsively, sort of referring to impulsively making decisions or actions without sort of thinking them through the consequences that might be there. For the diagnosis of this type of ADHD, again, similarly, 6 of the symptoms that I'm going to say need to happen, or 5 for individuals that are 17 years old or older. So they will be fidgeting or tapping with hands and feet, or they turn and twist in the seat. They're not able to stay seated in classroom or workplace. They run about or climb where it is inappropriate. They're unable to play or do leisure activities quietly. They're always on the go, as if driven by a motor. They talk too much. They blurt out an answer before a question has been finished. For instance, they may even finish other people's sentences, can't wait to speak in conversations. They have difficulty waiting for their turn while waiting in line, for example. They interrupt or intrude on others, for instance, cut into conversations, games, or activities, or start using other people's things without their permission. So then we have the combination type. So for this type of ADHD, it's diagnosed when criteria for both inattentive and hyperactive impulsive types are met. It's important to note that several conditions can mimic ADHD, like, for example, learning disorders, mood disorders, anxiety, substance use, head injuries, thyroid conditions, and use of some medications like steroids. ADHD may also coexist with other mental health conditions, such as oppositional defiant disorder or conduct disorder, anxiety disorders, and learning disorders. So a full psychiatric evaluation is very important. There are no specific blood tests or routine imaging for ADHD diagnosis. So sometimes patients may be referred for additional psychological testing, such as neuropsychological or psychoeducational testing, or may undergo computer-based tests to assess the severity of the symptoms. ADHD treatments usually encompass a combination of therapy and medication intervention. In preschool age and younger children, the recommended first-line approach includes behavioral strategies in the form of parent management training and school intervention. Parent-child interaction therapy, which is PCIT, is an evidence-based sort of therapy to help young kids with ADHD and oppositional defiant disorder. ADHD is not caused by a drug deficiency, but it may indeed be caused by profound nutrient deficiency, more accurately termed nutrient dependency. Although all nutrients are important, the one that an ADHD child is most likely in greatest need of is B3, vitamin B3 or niacinamide. Over 60 years ago, niacinamide therapy pioneer Dr. William Kaufman mentioned that a person receiving niacinamide treatment may wonder whether or not their vitamin medications contain a sedative. He has a book on the topic called The Common Form of Joint Dysfunction, in which he so accurately describes the problems of ADHD children that is difficult to believe that vitamin B3 has been so thoroughly ignored for so long. With vitamin therapy, these patients become calm, working more efficiently, finishing what they started. And when they feel tired, they're able to rest and don't feel forced to carry on in spite of fatigue. With ADHD, the traditional medicine seems unwilling even to admit nutrient deficiency as a causal factor, let alone a curative one. Depending on the severity of ADHD, the dosage can start from modest quantities of niacinamide, which is 250 milligram per dose, but the importance of the frequency, which is 6 or 8 times a day, is to be noted. The precise amount of niacinamide that an ADHD child requires needs to be thoroughly considered by the parent and physician, of course, and it is not a cookie cutter. So, on the metaphysical side, individuals with ADHD may be more sensitive to their environment, picking up on their energies and emotions that others might not even notice. This heightened sensitivity could lead to distractions and difficulties in concentrating. ADHD arises from a disconnection between mind, body, and spirit. So, addressing this disconnection through practices like mindfulness, meditation, or energy healing could be seen as a way to help manage the symptoms. Also, this can be a manifestation of an individual's energy being misaligned. The person may have heightened energy levels or unique ways of processing information that don't conform to traditional expectations, leading to difficulties in focus and attention. Hope this has been helpful. Like and follow for more. Be the light.